I'm here at the Cameroon Oncology Center in Douala.
I'm Mr. Imanji Polan. I'm a medical physicist. Thank you again, and I welcome you one more in Cameroon Oncology Center.
Well, thank you so much. And he's going to give me a guided tour of the place. I'm very excited. I look at the place. It's well built. It's clean. They're doing a fabulous job. And I invite everybody to come with me, see exactly the services they provide, especially now that when it's a cancer scare, it is important that you get yourself checked. It's important that you follow up because a stitch in time serves 9. That's very important. If you wait and it spreads, it becomes very difficult to treat, right?
Yes, doctor.
Yes.
Exactly as you said.
Yes.
This is the main reception. This is where all patients, we first wait for the start.
We're not sure. Hello.
Hello.
Wanasha. I'm Dr. Tata, and I'm from the US. I'm the cousin of Paul, Dr. Paul Mobit. Okay? So I really wanted to see exactly this center. Thank you so much.
You're welcome, sir.
So,
Okay, these are one of our consultation rooms.
wow. Okay, sorry for disturbing.
This is the other consultation room.
Okay. Hello,
Dr. Jobran.
Dr. Juba. Thank you so much for meeting you guys, okay?
Okay, let me just announce our visit to Professor Moelle, the specialist.
Hi.
Nice to meet you, sir.
Yeah.
Professor Moelle, this is Dr. Tata.
Hi, how are you?
Yes, I'm okay.
Yes, nice to meet you.
Yeah.
I said, let me come here and visit you guys.
Thank
Dr. Paul Mobit is my cousin and
Okay.
my Gino brother. I'm very impressed to see the number of patients that you have out there.
Oh, thank you.
And Paul just discuss with me, tell me exactly how things are going on.
Okay.
And I think I'm impressed. And I invite people to come to this hospital
Very good.
very well
Yeah,
because
thank you.
they don't have to stay until the cancer has gone to a stage where
Just like what we have been seeing in this country,
yes.
in
So-
most of the sub-Saharan African countries.
How different is this hospital from other hospitals in Cameroon in terms of this cancer specialty?
Well, it's a very good cancer center, and when we are talking of radiation therapy, we have three phases. We started with this equipment that radiologists were using, the 200 kV, in the years 1950. Yeah, 1950. Then we went to cobalt machines. Yeah, cobalt therapy. That you will find in one center now, a public center here in Douala. The one in Yaoundé has been closed for 8 or 9 years. Then after cobalt, which was in the 70s, you have the linear accelerator.
Linear accelerator.
Yes. There's a very good difference between cobalt
Therapy and linear
and
accelerator.
linear accelerators. And here the center is working, is one of the best center in Central Africa, the whole area of Central Africa.
So, let me get this. Are you saying in Cameroon there's only one linear accelerator working now?
As I'm saying,
And that linear accelerator is here in Douala?
it's here where we are standing in this hospital.
That's why I ask patients, take advantage of this, because this hospital will save your life. If you even have a problem with cancer that you have a question, call here.
Exactly.
You talk to one of the physicians and he will help
You-
guide you.
Exactly.
It doesn't mean that when you call, it means you must come here.
Yeah.
It means that when you call, you get
You
a
can
peace of mind.
discuss, exactly.
At least you talk with somebody who is a medical professional
Yeah.
in this field. So, once again, if you have the number, can you give me the number?
The number is 679-815512. Again, 679-815512.
Okay, doctor, professor, thank you for meeting you.
Thank you.
So, this is, your name is?
Dr. Itame.
Dr. Itame. And,
Cameroon Oncology.
yes. Tell us what you have in this pharmacy.
General drugs which we use to treat the side effects of chemo and radiotherapy.
Right.
And here we have the chemo drugs and drugs to treat pain, like morphine for extreme pains.
Mm-hmm.
And behind we have external solutions
Mm-hmm.
which we use to clean the wounds of the patient.
DT family, one of the importance for this institution is that it also handles general medicine. So a lot of people always ask, why will a specialized cancer institute have generalists? So it makes sense to have a generalist. People come here, some of them don't even know they have typhoid. This is more like a turnkey solution. A turnkey solution in that when you come here, they're not only looking at your cancer problem, but you're looking at your general health. I'm very, very impressed with the place. Thank you. And thank you. This is the CT scanner. This is a specialized institution with professional equipments and all that. Radiotherapy department.
So, as you can see, we have many monitors. We even have cameras. We have cameras inside the room. So from here, we see whatever is going on inside the room. When the patient is inside, if the patient is feeling comfortable, if the patient has an issue, you just lift the finger, and we are going to intervene directly.
This is where you have the linear accelerator, right?
Yes, doctor.
Wow! Wow! This is the linear accelerator. These are the professors who manipulate it, right?
Yes, these are Mr. Quentin and Mr. Sama.
Mm-hmm.
They position the patient on this bed we call the couch,
Mm-hmm.
and then they will position him according to some protocol.
Mm-hmm.
And from there out, everybody leaves the room, and the machine will rotate around the patient and deliver the treatment. This is Madame Michelle Kwesi. She is the chief radiation therapist. Madame Michelle, this is Dr. Tata, he's Professor Paul Mobit brother.
Nice to meet you.
Nice to meet you too.
Yes. You speak a lot of French?
Yes.
Mm-hmm. Bonjour.
Bonjour.
DT family, we've come to the admission floor, and let's see exactly what Dr. Paul Mobile has for us here. Unasha. Oh. You guys have been admitted?
Yeah.
So you're just
It's okay.
We're just relaxing here in Asia.
Okay, so this is admission room.
There are so many rooms here for patients. This is a structure that was designed by Paul and Elias. As you know, Elias then execute by building to specs. First, I want to thank you for giving me the guided tour. You tell me your name again.
My name is Mr. Imandi Pola, and the pleasure was mine, Dr. Tata.
I hear you are the big shot here.
Dr. Tata, you're welcome to Cameroon Oncology Center. Yes, I am the manager of Cameroon Oncology Center. Thank you.
I can see that you have good leadership, that you have a good structure, and that the doctors appear to be doing their job. They do it because there's a central focus, somebody who is taking care of the system. And what I've seen so far incorporates your attributes. I don't think any of this process will be in place without you.
You're right.
I don't think this place will be. I see lots of patients up there, but I think I need to see all Cameroonians who have cancer, given that this institution is one of the best, not only in Cameroon, but the whole of West Africa.
You're right.
And what can you tell me is the reason for your success?
Thank you so much, Doc, for that question. I think the reason for the success of Cameroon Oncology Center is that everybody working here is passionate. They're passionate about the vision. They are passionate about the center itself. They are passionate about taking care of patients. It is not, nobody can work at Cameroon Oncology Center or in a cancer treatment center without having passion, because sometimes it takes a lot. Sometimes it's really, really difficult, but if you do not have that passion, you can't do it. So the success of this center is actually attributed to the passion that every worker here has. Thank you so much.
Don't believe that when you have cancer, it means that it's the end of your life. This institution actually encourages and reassures people that you can be treated, you can be managed, and you live all your life. And it's because of the people working here as a team, teamwork. Even though you have a structure of the general manager, but you also have collaboration between the physicians, collaboration between all the workers, and people knowing what they have to do at every moment, whether it is an emergency or a straight admission. Any final words, Marceline, to the public?
Yes, Doc. First of all, I would like to thank you for believing in your brother's vision and helping him up to this level. I also want to thank you for visiting us again today. And of course, I want to tell the general public that Cameroon Oncology Center is where they need to get their cancer treatment. I mean, everybody knows, as we've been doing our publicity and telling Cameroon and Africa, that Cameroon Oncology Center has the best treatment. The treatment protocol is US standard, and they're getting it for free. So we are calling on all cancer patients in Africa and in Cameroon to come to Cameroon Oncology Center and get treated at an affordable rate. Thank you so much.
Well, thank you.